Yes, immune therapy in breast cancer, we're all very hopeful. Our patients are particularly hopeful, and let's face it, our patients feel a little left behind in this immune therapy revolution. It's not for lack of us trying, it's just that breast cancer is different than a lot of these other tumors where immune therapy has been particularly helpful. It's also worth saying that for breast cancer, we actually have a lot of drugs that work, and some of the tumors in which immune therapy was first approved have pretty limited options. And so there was you didn't necessarily need to see a huge impact to have a massive change in the field. For us, tumors shrink pretty well to chemotherapy, and so we have kind of a higher bar to prove that these drugs add value in that setting. But it's also true that breast cancer is just fundamentally different than, say, melanoma or lung cancer, where there's very high tumor mutational burden, and again, there may be more infiltrating tumor lymphocytes and things like that. So we need to understand in breast cancer which groups are most likely to respond. Breast cancer is very, very heterogeneous, and there are many different types, so we have to get a better understanding of what's going on. As mentioned, the exciting areas are that there does seem to be a signal in triple-negative breast cancer, particularly in the first line, and that is great. And I think the value of immune therapy is that the responses can be really, really durable. But it is worth saying that we're still not seeing the same responses in first-line triple-negative breast cancer that we do with chemotherapy. So we've got to figure out how to make this work in combination.